The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.
Holding the government to account is job one for the official opposition. But during this now year-long crisis, it can be tough to break through the emergency messaging and daily briefings. Tonight, Ontario NDP leader Andrea Horvath joins us with her party's view of the government's response to COVID-19. Then we'll hear from Ontario hubs about efforts in Hamilton on advancing the cause of what's called a living wage. And from the vaccine rollout to free speech and democracy, we've got the Agenda's Week in Review. I'm Nam Kiwanuka. It's Friday, March 5th, and that's ahead on the agenda. In normal times, the leader of Ontario's official opposition would have plenty to put to the government. These are not normal times. Huge issues loom large. Long-term care, class sizes, the vaccine rollout, paid sick days. NDP leader Andrea Horvath is, of course, that leader, and she's had the massive task of trying to hold the Ford government to account, even as it manages this pandemic. Andrea Horvath is an NDP member for Hamilton Centre, and she joins us now from Queen's Park to look back on a year like no other. Hi, it's nice to see you again.
Nice to see you as well, Nam.
I think the last time I saw you in person, in the before times, we were on stage for a youth debate, having a bit of a dance-off. And I hope there's no video of that anywhere.
I hope so too.
For my sake.
Although it's not likely.
For my sake. So we've got lots to talk about in the next 25 minutes or so. You know, it's been a year like no other, like I mentioned. When it comes to their pandemic response, what do you feel has been the Ford government's biggest misstep?
I think their entire approach has been too slow. They haven't had the urgency that they should have had, and you can see it through a couple of pieces right up at the beginning, telling people to go away on their March break and then having to change gears really quickly. The fact that long-term care, the second wave was even worse than the first. They never did put that iron ring around long-term care, and they didn't actually act with any urgency in long-term care. And then even with now the vaccines, I mean, it's a slow and kind of sloppy rollout, and it's not very transparent. So it's kind of the lack of urgency and the lack of transparency.
I can imagine in your position there's so much news happening all of the time. You just mentioned long-term care. After the first wave, the government said they would build an iron ring around Ontario's long-term care homes. How would you describe what it ended up being?
Oh, there was no iron ring at all. It was a complete fallacy. And in fact, that is confirmed by the testimony that the Minister of Long-Term Care provided at the Long-Term Care Commission that the Ford government has put in place. I mean, she quite clearly showed in her testimony that there was nothing done. There was no extra staffing put in place. There was no infection prevention and control protocols or plans put in place. They literally forgot long-term care when it came to the distribution of PPE. It was a mess, and people lost their lives, and families lived through just terrifying fear about their loved ones, and then just brutal tragedy of mourning and loss.
The Premier says that he wishes you would work together with him as part of a shared, what he says, Team Ontario approach. In the past year, what's an example of a time you've worked together with them on something?
Oh, in fact, especially right from the beginning, back in March and April, we were very careful to to be as proactive and proposal oriented as possible. We sent the government all kinds of recommendations, all kinds of specific details from our various critics in the various ministries, because we knew that a lot of those ministers were pretty new, and many didn't have the kind of insight as some of our members had. And so we really did work to propose solutions for the government, everything from Save Main Street to paid sick days. Some of those fights we're still fighting, as a matter of fact. So from the very beginning, it was about exactly that, trying to be, proactive and proposal oriented, and not not overly critical. But as time has gone on, of course, the government, has not done what it needed to do to prevent the spread, to prevent lockdown after lockdown. So we've, kind of shifted. We're still proposing ideas. In fact, we came back to the legislature in the middle of February with 9 different motions and bills, everything from paid sick days to caregiver rights. Unfortunately, the government, it really, he talks a good game, but they're not interested in working with the opposition. And so we're pushing forward, though. We're fighting for Ontarians. We're continuing to put these proposals on the table and hoping for the best.
And I know this is such a tricky time for everybody, too, because I think a lot of people the people who are fighting for them are the politicians that they've elected. And so when we talk about this idea of working together, since COVID-19 struck Ontario, have you met with the Premier privately to discuss the province's response?
No, he's actually he's offered a couple of times in the legislature, but it was really a hollow offer. The follow-up just wasn't there. I've met with a grouping of MPPs, particularly cabinet ministers, health, long-term care, finance, before the finance minister lost his position. That would have been Rod Phillips. Mm-hmm. But again, it was, it wasn't a collaborative type of conversation. It was, we were asking questions, they were getting defensive. It was not very productive. And that's unfortunate, because a lot of the things we've been bringing to the table are based on, not NDP ideas that come out of nowhere, but on the science, that the government's getting, on what the experts are saying. And so we've tried really hard to push the government to make decisions based on the appropriate advice. And we've seen, just recently, we've seen that that's not what happened throughout this pandemic. In fact, Christine Elliott, the Minister of Health, basically said to the Commission around the decision to open up asymptomatic testing to Ontarians back in May, that you'd have to ask the Premier why that decision was made, because that's certainly not what the experts were recommending. And so there's always been this kind of lack of understanding and lack of clarity around who is actually making the decisions. The Premier says it's the Chief Medical Officer of Health advice that he's always, following, but the Commission heard from the Minister of Health that that's not the case.
I'm guessing that the Premier and his party are saying, we're doing the work, we're doing the hard work. If you were Premier, you would have inherited the same healthcare system Premier Ford did. And maybe some people are saying you're criticizing, but what would you have done? Day one of issuing the state of emergency last March, what would you have done differently if you had been Premier?
Well, I mean, it's interesting. We have, I think, much different ideas than Conservatives or Liberals when it comes to our healthcare system. We had been, for years now, advocating for and putting private members' bills into the legislature for the 4 hours of care for every resident in long-term care. So we would have been, we were aware that I actually toured the province myself several times in the time I've been leader of my party to try to get some attention to the long-term care issue. So we would have known that was something that we needed to deal with right away. But we would have already been working on some of those pieces, because let's not forget, the election was, a year and a half or so prior to almost 2 years prior to COVID hitting Ontario. And so we just, we have a different way of doing things. We respect public health. We respect, the healthcare professionals. We knew hospitals were, experiencing a hallway medicine. These are things that are really important when you're, having to deal with a global pandemic. And so, I just know that we see things a lot differently than the Conservatives, and we actually believe that it's our job to protect people. We would have actually been a lot more transparent and open. I look at New Zealand actually as a kind of model as to what we might have done. BC has done a lot of the things that we would have done. Stopped almost immediately the movement of PSWs in between long-term care homes, trying to staff up in long-term care. I mean, BC and Quebec were able to, in the summer, staff up their long-term care homes. Nothing happened in Ontario.
Well,
nothing at all.
You said something interesting over there. You said that if you had been in power, you would have been more open and transparent. So in what ways do you think that the current government is not being open and transparent?
Well, I've already alluded to it just in terms of how the decisions are being made and who's making those decisions, and what it is that their decisions are being based upon. We don't know any of that, but we also have seen a government that even now with the vaccination rollout, they're not clear about how they're making decisions around the rollout, and the specificity around the various phases of the rollout just isn't there. And we know it can be more specific because we see other provinces not only being more specific, but putting that information out for everybody to see on the internet. And that's definitely not what's happening here. And in fact, as a result, you see, for example, the science table pushing the government, as we have been, to make sure that the hot spots, the places where, frankly, our COVID heroes live and work, need to be prioritized in the next phase of the vaccination. Something we've been pushing for some time now, making sure that people who are immunocompromised are also prioritized in the next phase. But we shouldn't. People want to do the right thing, but they also want to have a sense of hope that their vaccine is coming and that they get an understanding of when that's going to happen. And I get it. There are issues around delivery of vaccine that the government needs to be, kind of aware of and flexible on. And I think people need to cut slack there when it comes to the government's plan, and understand that there are variables that they don't have control of, but at least getting a sense of how things are going to roll out. It's been problematic. And this because the government didn't want to spend the money on putting the task force together early enough. I mean, they waited till the beginning of December to put the vaccine task force together. Mm-hmm. They should have been doing that in September, October, well, because everybody knew the vaccine was going to be a big part of the controlling of this virus.
Well, Premier Ford has said that a lot of the decisions that he's made have been based on the advice of the Chief Medical Officer, Dr. Williams. One more if question. If you were Premier with a majority government, would you fire Chief Medical Officer Dr. Williams?
Well, I've had some real concerns about the way that this has been dealt with, the COVID-19 pandemic. I have had some concerns about the communications being very confused, very unclear, and I think everyday people would say that that's also a concern that they've had. So I think all of these things need to be taken into consideration. Ultimately, it's up to Doug Ford to make sure that the proper people are in the proper places to provide, the guidance and the direction to get us through a global pandemic. I think that's something that sits at the feet of Doug Ford. And have I been disappointed and concerned about the Chief Medical Officer? Absolutely. But my job is to remind people that it's Doug Ford's job to put the right people in the right places.
I want to look at some numbers here for a second. The results of a Main Street research poll, which was held midway through last month. Ontarians were asked if an election were held today, who they would vote for. And this is what they said. 36% said they would vote for the Conservatives, and half that number at 18% would vote for your party, the NDP. 21% would go for the Liberals, 17% 9% were undecided, 5% would consider the Greens, and 3% for another party. And some more specific findings from the poll. When people were asked if Premier Ford was doing a good job managing COVID-19, 46% said yes, he was. When they were asked if you were an effective opposition leader, 17% agreed with that, while 24% said they didn't know who you were, and 10% of people who said they would vote NDP said they were unfamiliar with you. You've been in public service for a very long time. When you hear those responses, how do you respond to those findings?
Well, you know what? Polls go up and down all the time. The most important poll, of course, as I always say, is Election Day. Right now, people aren't focused on, that kind of politics. People are worried about what's happening to kids at school. Are they being exposed to COVID-19? Why isn't there massive testing of kids in schools, even though it was promised? They're worried about, are they going to be able to get their job back? A lot of women are worried about how are they going to be impacted when it comes to trying to, to regain a place in our economy. Right now the focus is more about COVID-19, what we're going through, how we're going to get out of it, and that's where I'm going to keep my focus. I mean, from my perspective, is not about me. It's about making sure that that we fight for Ontarians day in and day out, which is what I do, and try to push the government to provide for what people need, not only to get through the virus, but to rebuild after.
Well, you mentioned, what matters is Election Day. The Ford government is facing a once-in-a-lifetime pandemic, and the once powerful Liberals are no longer an official party, meaning that they're missing out on millions in public funding that your party has. Their new leader doesn't even have a seat. And yet the NDP is in third place, and few people seem to think that you're challenging the government effectively. Why have you not been able to capitalize on this and gain the approval of Ontarians?
Well, again, I don't think a moment in time poll is an indicator of how Ontarians are feeling. The polls go up and down. There have been different ones on either side, and there will be more when it comes to the polls. Again, I just know what my job is, and I'm going to keep fighting. And again, the kind of the environment that we're in right now is one that that's got people's focus in a different direction, and rightfully so. There's a lot of things that people need to worry about and be concerned about, and I'm just going to keep doing the work that I do, not only to hold the government to account, because I have been doing that, but also to propose solutions, not only in the context of this pandemic, but also in the context of a vision for Ontario that is more hopeful, that is more focused on people and families, and not like developers and insiders of the Ford government, which is unfortunately one of the things that's happening under the cover of COVID. Is Doug Ford is giving a lot of gifts to his developer friends when it comes to ministerial zoning orders and development. He's just actually brought big money back into politics, and that's troubling. But our party's strong, and our MPPs are strong, and they're bright, and we have, I think, a great opportunity to not go back to the way the province was governed, with the disappointments that the Liberals provided for 15 years in office, and not have us go even further backwards with the Conservatives. I mean, this is a really important opportunity, I think, next year to chart a course forward where everyday people are the focus, not big money developers and not Liberal insiders, but everyday people, and that's the work that we always do.
You mentioned everyday people, and you've also mentioned a few times that what's important are Ontarians. The last election, the majority of voters chose the Conservative Party to lead the province. How do you balance, in your position as the official opposition, holding the government to account? How do you balance that without alienating those people that voted for this government and do believe that he's doing a good job?
Well, again, I think it's a matter of just doing the kind of work around, where the government has made decisions that aren't about everyday people. I mean, and I mentioned a couple of them already. but what we know is that before the pandemic hit, Doug Ford was cutting and insulting public health. Doug Ford was cutting long-term care. Doug Ford was handing lots of goodies to his developer friends, and that's still happening in the context of COVID-19. Doug Ford was downloading on municipalities, and he's not changed. He's the same Doug Ford. He's got a different task right now, and is dealing with COVID-19 in a way that I don't think has been fantastic. But certainly, let's not forget what this government's all about. They were causing some pretty serious damage to Ontario before the pandemic hit. And I think people know that that's what's coming again once this pandemic is all over.
It's always awkward doing these interviews because, Doug Ford's not here to speak on his behalf. So I want to focus a little bit on you. You're now the longest serving major party leader in Canada. You've led the NDP for nearly 12 years to the day. Congratulations. You're heading into your 4th election, and you've been leader for 3, increased your seat count, but you've never won. And I'm guessing that this is something that you've probably thought about in moments of reflection. You've put in the work, yet voters haven't chosen you for the top job. Why do you think that is?
Well, I mean, I can tell you going forward for 2022, I think that Ontario is ready for the very kinds of solutions that New Democrats bring. And I don't think any other party is going to bring those kinds of solutions. Having said that, you're correct. I mean, when I took over as leader, which is kind of a funny story about our leadership race, because there were only 8 NDP MPPs in the legislature. One was the former leader, and 4 of us ran for the leadership. But I've been able to not only build our party, but build our caucus, or vice versa. We're the only party that's ever had a Black caucus in our province. We're the only party that twice now, 2 elections running, have been able to elect 50% of our caucus as women. And these are all amazing achievements, and we're not going to stop. We're going to keep going. Government should reflect the communities that we serve, and we're committed to those values. And so I think we've done a great deal to change the face of politics in Ontario, and to bring voices to the table that otherwise wouldn't be here. And so I see these things as positives, certainly not negatives.
Let's move forward to the next election.
Sure.
If you're not chosen to be premier of the province, would that be the point where maybe you decide to step aside as leader?
Well, I mean, that's certainly a road that I'll get to, or a bridge that I'll cross once the time comes. In the meantime, my colleagues and myself, our party, our team, our MPPs are going to keep offering Ontarians a choice. We don't have to go back to disappointment after 15 years of Liberals. We don't have to continue to support a party that's more interested in its developer buddies and well-connected folks. That's not what the NDP is all about, and people have a choice. And as I said, particularly coming out of this pandemic, many of the ideas that we bring to the table are ones that are particularly suited for Ontario to pull out of this pandemic in a way that is that is just, that is equitable, and that is focused on everyday families, and not just the top corporations like who Doug Ford tends to rub elbows with.
Well, a few days ago, Premier Ford called the NDP the opposition party of doom and gloom. He likened your criticism of his government to, quote, listening to nails on a chalkboard. When you hear all that, you think what?
It's just sad that we have a premier who goes to the very lowest place when he's feeling pressure. It's my job to be the official opposition. So that includes criticism. It includes, absolutely being oppositional, but it also is propositional. And so we've been doing a lot of the proposing as well. But Doug Ford, I mean, that's his personality. That's who he is. He goes to the lowest possible place and shoots out an insult. I'm a big girl. I've got a tough skin, and I'll deal with it. But I'm going to focus on Ontarians and not on Doug Ford's way of behaving.
In our final minutes here, a lot of things I've mentioned a few times. A lot of things during this pandemic have changed, including how daily briefings are conducted. The government obviously has the microphone, and Premier Ford makes daily announcements. The media broadcast in full. The legislature has a skeleton crew, and many journalists are isolating at home. Even how the scrums are done, it's changed. You can't really hold in-person events. When it comes to being leader of the official opposition during this most difficult time, what do you think has been the most challenging thing for you and your party?
Well, I mean, I think you've just kind of described it. It's really quite different. It's really quite challenging to be able to find the space, if you will, that is being allotted to the governing party, and that's just the nature of what's happened with the pandemic. So we've tried to I think we're all zoomed out, but certainly we've been trying to do events, not only media events, but events with Ontarians, trying to get people's voices out there as well. People whose parents or loved ones have suffered in long-term care, workers who have been exposed to and contracted COVID-19 on the job because they didn't have the protection. So we've been trying to utilize some of these other tools to bring those voices forward and to fight for those people. But I certainly do miss the scrum.
You do?
I do miss the kind of, yeah, of course. It's because it's dynamic. Do you know what I mean? It's very dynamic, and it moves very quickly, and there's just a sense of just a sense of almost strangely a community of both media, opposition, and others trying to hold the government to account and provide a picture to Ontarians about what's happening here in Queen's Park. And I think some of that's been reduced. Some of that opportunity has been reduced. But again, we are doing our best to find the places to get our voices out there on behalf of Ontarians and hold the government to account, and we're going to continue to do that work.
Ms. Horvath, thank you so much. I know you have a lot on your plate, and we do appreciate you making the time for us. Thank you so much.
Oh, it's my pleasure, Nam. Take care.
The city of Hamilton pays all but its summer students a living wage, but particularly as the pandemic drags on, some are saying that's not enough. Justin Chandler covers the Hamilton-Niagara region for our Ontario hubs, and he joins us from Hamilton on efforts there towards what's called a living wage for everyone. Welcome to the show.
Thanks, good to be here.
Now, before we begin, I want to show this video. Sheldon, if you may. What is a living wage? The minimum wage in Ontario is $14.25 per hour. Depending on where you live, that may not be enough to get by. According to the Ontario Living Wage Network, a worker must earn a certain basic amount to cover expenses. That amount is what 2 adults working full-time would need to support themselves and 2 young children. It includes food, shelter, childcare, transportation, medical expenses, a modest vacation, and a small emergency fund. It does not include retirement savings, debt repayment, home ownership, or education savings. Living wage hourly rates were last updated in 2019 and vary by community. In Toronto, the rate is $22.08 per hour, while in Hamilton it's $16.45. Advocates are calling on employers to pay a living wage, not just a minimum wage, so workers can support themselves and contribute to the local economy. Now that we know what advocates are recommending, let's see how possible it is. Justin, you spoke to some people in Hamilton wanting their wages bumped up to a living wage. What did they have to say?
Yes, well, this is something that we heard a lot about at budget delegations in Hamilton this year, which was when the public had some time in February to speak before council and tell them things that they wanted to see. And for the city to pay a living wage was something that a lot of people asked. They wanted to make sure that the 200 or so city employees who are not paid that rate, who are paid between minimum wage and a living wage, were able to get to there. And they say that this would allow for other employers in the city to sort of be influenced and to perhaps pay more if the city can set that moral precedent. And they say that this is important. For example, this one student who I spoke to, Brock Bodo, he delegated before council, and he told me that in his case, working a close to minimum wage job with the city in 2019 was not enough to cover his expenses and pay down his debt. And so he says that a fear he's got is that when he graduates school and he's got a few $1,000s in student loans to pay down, he's not going to be able to live in the city that he grew up.
I actually want to pull up another clip. This is a clip of Aya Yunus, another person you spoke to, and this is her speaking at Hamilton City Council last month.
So we have parents who work in precarious jobs due to the labor market, and as a result, their kids who are students need to work to contribute to household necessities. And I myself have that responsibility. Right. And so what about students who live with one parent, or live alone because they have no parent relationship? So everyone's life is different. Not everyone has the same privileged lifestyle as a student. And we need to not forget that we're the same students who need to pay for school supplies, transportation, food, and the list just goes on.
So I touched on a little bit about that, but why is it important that student wages be considered in this living wage?
Well, as I think you heard in the original explainer, a student living wage would be the same as a regular living wage. And that's usually considered something that would be for two adults who are looking after children. But what Aya pointed out there is that a lot of students, they may be older and looking after children. They may be younger and looking after children. Or perhaps they're also paying to support their parents. So everybody's situation is different. And just because somebody happens to be a student doesn't mean that we can assume that they don't need a living wage. That's what they say.
Now, for your article on tvo.org, you spoke to city councillors in Hamilton. What did they have to say about the living wage?
Well, that idea that perhaps it's not something that's intended for students is something that came up in 2020 when this was debated before council. And I spoke to one councillor for my article, Terry Whitehead, who was quite against it at the time. He likened paying a living wage to students as paying tuition for other people, which he said was the worst kind of socialism. And when he spoke to me, he maintained that he understands, he says, that some people do have more difficult situations, and he thinks that those should be dealt with case by case. But he felt that paying the 200 or so employees in the city a couple dollars an hour more was more than needed to be done, especially during difficult economic times.
And you also spoke to Hamilton's mayor, Mayor Fred Eisenberger. He had, I guess, a bit of a different tune than Councillor Terry Whitehead, right?
Yes, absolutely. So the mayor says that he thinks it's completely inexcusable that anybody who's working a full-time job can't get by on their wages. And he thinks that the city should be paying a living wage for the same reasons that advocates said. He says that at this point, most employees in the city are paid this much, and he doesn't think it would be too much work to extend that to the remaining students. He says he thinks that it would help them out and it would set an example.
So, this sounds great, increasing, the dollar amounts in Hamilton. It would go up about $2. But this money doesn't obviously come out of thin air. This is businesses having to move their profits or revenue over to pay for, those salaries. How would this cost businesses? What are they saying?
Yes. Well, so this is where it gets more complicated, of course. So I spoke to Dr. Kate Rybczynski, who's a labor economist at the University of Waterloo. And what she told me is that any time that wages go up, be it minimum wage or be a business deciding to pay a living wage, a few things can happen. Businesses can choose to take less profit. They can pass through prices so that consumers are paying more for goods and services, or there can be some disemployment effects where maybe they hire fewer people or they let some employees go. So these are all things that can happen. And she says that she thinks that a business could potentially just take less profit and still be able to do these things. But as we've seen with cases where, say, Loblaws, she brought up, decided to pull back pandemic pay despite making significant profits. It's just not something that a lot of businesses like to do. So it's important to keep in mind that, yes, wages can go up and that can help a lot of people, but we also have to think about what businesses might do in response to that.
We also have to think about, the future of young people. Advocates say that a living wage is what will set them up for success. And I ask, how so?
Well, it's the sort of thing where people say every little bit helps, right? And maybe a couple dollars an hour now, Aya told me, If your hours have been cut, and we know that a lot of people who are working in precarious jobs have seen more unemployment than other people, that's certainly been the case in Hamilton, studies have shown. So she says, let's say you're working 10 hours now, a couple extra dollars an hour, that could really help you toward making rent at the end of the year. And as the economy gets tough, certainly any savings will go into this. And Kate Rybczynski also said to me, we want to make sure that as we're going forward, we're not stopping people from starting families. When you think about that living wage, if people can't earn enough to save up, then that might be an option that we're taking away from them.
Justin, I want to thank you so much for bringing an important story to the forefront. That's Justin Chandler, Ontario Hub's journalist covering the Hamilton and Niagara region.
Thanks so much, Jan.
The agenda this week assessed the COVID-19 vaccine rollout in Canada, debated free speech and democracy, and looked back at 2 decades since the human genome was first mapped. The agenda's Week in Review begins assessing what went wrong in long-term care in the province.
Once the virus gets into the home, and this is what matters the most, how do the for-profits handle it? And the rest of that paper outlines in black and white that they fail to control that outbreak. And that's what matters. Getting one outbreak, getting one case, that's an outbreak, is not the issue. It's how you manage it once it gets into the home, and they can't. They've had the deadliest outbreaks and the highest mortalities, and even the Stahl paper found that. So
can I just follow up with you on that? Let me just follow up with you on that. We know there have been outbreaks in lots of long-term care homes across the province. Once the outbreak hits, why would, in your view, the level of care in for-profit settings be any different from in not-for-profit settings?
Well, I'll tell you why, because it boils down to staffing. And that's also something that the Stahl paper didn't have. They don't have information on staffing because this sector refuses to publicly make that information available. Correction, the for-profit sector refuses to make that information publicly available. So we know, frankly, that ownership matters when it comes to staffing. Staffing matters when it comes to managing outbreaks. It is irrefutable that the for-profit homes hire less staff. They hire less full-time permanent staff. They pay their staff less, and they produce less hours of direct care per day. And you know why? You know how that impacts to resident care and the COVID outbreak? Because this is what happened. When the April 22nd directive came limiting employment to one home, what do you think happened? The workers at the for-profit homes left. They left for greener pastures. They left for places that paid them better and had better working conditions, period. And that was corroborated all throughout the testimony in various different testimony transcripts in the commission. So we know that. And then we saw in black and white, all of us saw this in real time, in addition to the testimonies, that what happened was that many of the for-profit homes were in a mad dash to find workers. Oftentimes, they threw workers without proper training onto the floor in the worst time, possibly, period. And what happened was negligible infection prevention and control mistakes were made that led directly to resident deaths. I mean, this is a very clear causal chain here. I mean, we have evidence, Sunnycrest, Tender Care, Roberta Place, in ministry inspectors' reports showing clear negligence that resulted in increased death. We have leaked paramedic reports from St. George.
I hear you. Let me give Donna Duncan a chance to respond. Lots of stuff to respond to there. Donna, go ahead.
Yeah.
Yeah, certainly. And, we're going to agree to disagree with Dr. Vivian insofar as, our for-profit homes, our nonprofit homes, everybody struggled in this. As Andrea Picard said, this wasn't a fair fight for anyone. If we look at the ownership of homes, the larger chains and private homes largely are for-profit homes because the nonprofit and charitable homes were rebuilt during the Harris government in 2000. The last time we had any significant movement, we have members of all ownerships who have made multiple applications to rebuild these homes over the last 20 years, and it hasn't happened. And
why not?
Yes.
Why has it not happened?
If we look back to 2007, when the Liberal government of the day made an announcement and a commitment to two things: aging in place and rebuilding these older homes. They moved forward in aging in place, but they didn't move forward on these homes, and we are seeing the consequences of that, and we need to move quickly. And I think the other thing I would say that. And just to echo Andrea Picard, we're getting caught in a divisive, polarizing debate around ownership. We don't have the luxury of time for this. This is a very emotional debate. I know, I feel it. We've had tragic loss. But quite honestly, we need to mobilize to work towards solutions, to find a way through. We need to build a workforce. We need to work to build out that force of care. We need to rebuild these homes, and we need to find a way to rebuild confidence, rebuild the morale and the mental health and well-being of our residents, because I don't think it's an overstatement to say that all of this fighting and this polarized activity is having devastating consequences on our existing workforce. And as much as our government has tried to attract people in, money's not going to help, morale's going to help, and how we talk about this workforce and how we support the workforce and focus on the people who are living in these homes and working in these homes, we're not going to make sure, we're not going to have a system that's going to be able to support the care.
All right, let me get Pat Armstrong on this. Pat, do you believe that there is a difference in the quality of care and in the ability to fight COVID-19 between for-profit and not-for-profit long-term care homes?
Yes, I think we have considerable evidence to indicate that. Do I think it's the only factor right now? No, it's certainly not, but it's certainly a factor, I think, from all of the evidence we've had. And as I said earlier, we had evidence pre-COVID of more hospital transfers, more bed ulcers, higher mortality, for instance, in for-profit homes, a clear pattern. So, and the staffing levels, as Vivian pointed out, are absolutely critical. And not just the staffing levels, but the proportion of staff that's part-time. And that's true across all of the homes, but we know that that proportion is higher in the for-profit homes. We do have to increase the full-time staffing across the board in all of the homes. It's absolutely critical.
Carolyn, I wonder if you could help us understand the priority list right now, because obviously I've heard from lots of people who say, if you really want to make a dent in this thing, in COVID-19, go for congregate care settings first. So obviously long-term care, homeless shelters, prisons, that kind of thing, that's where the virus really loves to spread. On the other hand, you can imagine some people who pay taxes saying, wait a second, I pay taxes, I want to get ahead of all of that group of people. How do we resolve these competing interests here?
Yeah, so I think it's, the congregate settings is about risk, especially in long-term care. And, for better or worse, the decisions we made were not able to protect our long-term care populations. And so putting them at the very top of the priority list absolutely makes sense because of both exposure and risk of a bad outcome given exposure. The same goes for the very elderly. But after that, what we're finding is it's not so much about who pays taxes, it's about who's at risk of being exposed and being a transmitter. And I think now that we know how powerful the vaccines can be against transmission, so preventing people from getting infected, and then if they're not infected, they can't infect their contacts. What that means is we have an opportunity to get the most bang for our buck of rare, relatively scarce vaccine doses by starting to prioritize essential workers, people who cannot distance at their work. They can't work from home. They have to work in essential services, frontline work, maybe teachers, firefighters, grocery store, food production. We've, of course, seen outbreaks in food processing. These are areas where actually with one vaccination, you can prevent more bad outcomes in those groups because you prevent the bad outcome in the person you vaccinate, but also in a whole bunch of others who don't get infected because you stopped chains of transmission. So I think that's where the conversation should be turning after we finish vaccinating the very most vulnerable.
Isaac, can I get you on that? What should the priority list look like? In what order?
Yeah, great question. And clearly, there's some pretty heated debate on in media and in social media and in conversations because everyone seems to have, and rightfully so, some very strong opinions on this. I think you can approach this through a data-driven lens. You can approach this through an equity lens. You can approach this through public health lenses. And of course, the Venn diagram of those lenses overlaps at some sweet spot. Yeah, I completely agree with Dr. Collane that there are strategic ways to vaccinate populations to get the most bang for the buck. I think we have to acknowledge who's at risk of death, who's at risk of having a serious outcome, and of course prioritize that. And that's equity and a public health and data-driven approach. Age is like by far the biggest risk factor, and we just can't ignore that. Now, there's a lot of risk factors for severe outcomes, but age stands above just about everything else. So we clearly have to vaccinate by age. But there's multiple right ways to do this. And for example, you've heard in Ontario, you can look at not just age, but for example, other social determinants of health that could help drive a very equitable and data-driven vaccine program. So if you look at something like postal codes, well, as it turns out, someone who's 50-year-old in certain postal codes has the same risk of dying as someone who's 80-year-old in another postal code. So if you really want to take a data-driven and equity-based approach, you can look at a variety of measures, a variety of mechanisms to vaccinate based on age, based on postal code, based on, and of course, a variety of other factors as well, like Dr. Colleen mentioned, essential workers as well. So what you're going to see from coast to coast, well, I guess we're talking about Ontario. So what you're going to see in Ontario when the plan is hopefully released sooner rather than later, is that the second wave of vaccinations will be prioritizing people who are at greatest risk of having a severe outcome from the infection, but B, as Dr. Colleen puts it, people that are obviously at greater risk of getting this infection, but also of facilitating transmission in the community. And of course, that does include congregate settings as well.
In Canada, there is a certain feeling, I think, that the people have been almost convinced that if they speak their mind, not even particularly offensively so, they could be in trouble. I don't think that's the reality generally. Now, there are excesses, as I mentioned earlier. I've seen them, but I'm an aberration in many ways, in that I went back to university 5 years ago as an old person. And for 4 years, I saw various colleges at the University of Toronto. I have to tell you, very little had changed. The kids were probably nicer than when I originally went to university. They worked harder. But free speech didn't seem to be a major issue. People were still expressing themselves. But I would agree there is a feeling out there that if I speak my mind, I'll get in trouble.
Irshad, I wonder if you could follow up and bring into it the American point of view as well, because you've obviously lived in the States for some time. A recent survey in the U.S. suggested 62% of Americans are afraid to share their political views. Do you notice a difference between the two countries on either side of the border on this front?
Not in the sense of fear. People do live with fear today. Some are resentful about it. Some have simply resigned themselves to it. And, we talked just briefly moments ago about social media. Obviously, given that, one tweet could mean not just character assassination, but frankly, the loss of your job, and certainly the elimination of a healthy reputation up until that point, people do worry about what's going to come out of their mouths. And the other point to make about all of this is that we are living in a time of very low social trust, by which I mean not just trust between citizens and government, but frankly, trust between and among people. People generally believe that if we are going to say anything that's going to tweak somebody else's nose, even inadvertently, that discussion will instantly become a debate. And I have seen, Steve, with my own eyes and with my own ears have heard, people don't feel comfortable with debate. Only the loudest, most extreme voices go after debate. They foment it. But everybody else who's basically more interested in solutions and getting on with their day than in, bogging themselves down with their egos, most people actually fear having discussions turned into debates, and therefore will think twice before even launching a discussion about something that could be complicated enough to warrant a debate.
Sheree, what do you think it says about the state of free speech in Canada when apparently fewer than 1 in 5 of us feels comfortable expressing their views in public?
Some of that could also, I would like to see how that would compare to maybe 5 or 10 years ago, because a lot of people are simply not comfortable being open in public, whether it is because of the pushback they're going to get or whether it's just self-consciousness. To some level, I think this is also about self-censorship. And self-censorship is not necessarily a bad thing if it means that you are about to say something that could be bigoted, racist, misogynistic, and you are stopping yourself to self-reflect upon it. So that's not such a bad thing. A little bit of self-reflection and thinking through consequences is a good thing. If we are talking in terms of debate, I have to agree with Irshad that I don't even believe debate is the best way to solve these problems, because a debate is not necessarily a place of trust where you don't begin with any kind of a common ground. Whereas on a person-to-person interaction level, yes, you have a certain maybe relationship and you can begin with that. Social media may not be the best place, but often that's where a lot of pushback happens, because especially if it is by traditionally marginalized people who've never had access to those so-called debates or discussions. And this is one place that they had that access, and they're using that access point to push back. And in return, what would be nice is if people who have never been challenged before stop to listen and ask why. Why is it that somebody is pushing back? Is what they're saying actually not right?
I'm talking about things that are just sort of like, ordinary, everyday, politically incorrect things, and you say you're going to lose your job. Does that person who loses their job go home and say, wow, I really need to educate myself about intersectionality? This period of unemployment is a great time to watch some videos by Robin DiAngelo. Thank you. Thank you for giving me this period of reflection. No, of course not. They're going to become more vested in whatever ideological vector took them to, and it may have been no ideology. I mean, sometimes people just say casually intolerant stuff.
July 7, 2000. Go.
That was definitely the highlight of my life. We were racing like crazy to get the genome done and out there. And at that moment, I had to look back and say, here is a long sequence of A's, C's, T's, and G's. As a computer scientist, as Aravinda was saying, it's just information. But in fact, it represents the struggles and the triumphs of our ancestors since the dawn of time. I mean, this is the message that has been passed on like the Olympic torch from parent to offspring for so many millennia. And now it comes to us, our script that was forged by our ancestors. And at that moment, I realized that we had put it together. 20 different centers from around the world had been cranking out sequence like crazy as fast as they could in anticipation of the announcement at the White House on June 26th that the first draft was complete. But that draft had not actually been shared with anybody. And because we did the computational part of assembling all of the pieces in this mad rush to get it ready for the White House ceremony, we had the honor of posting it on the internet. And again, like Aravinda said, there are two great technologies of the late 20th century, which are molecular biology and bioengineering and computer science. And they came together in that moment. We posted that first draft on the internet, and now our genome was copied at the speed of light, spread around all of the planet in a very non-biological way.
Let me just jump in with a quick follow-up there.
Heritage.
Why'd you put it up on the internet?
Oh, this is a matter of principle, really. Our competition was making it available only by subscription and claiming intellectual property on it, and we felt that that was inappropriate for that information that is so fundamental to humans. So we put it on the internet free without any restrictions on use and no claims of intellectual property.
And Shirley, when the news eventually got out, for you, what were some of the biggest surprises in terms of discovery?
Well, I think the biggest surprise was how few genes we actually have as human beings. I had been teaching for years that the human genome probably had something on the order of 100,000 genes. But when we were able to look at David's ensemble and begin to count up the number of genes, it was shocking that the number is probably in the order of about 22,000, not 100,000. And this was a humbling moment because, after all, we knew how many genes there were in these other organisms that we'd sequenced, and it wasn't that many fewer genes. So suddenly we had to contend with this huge, I think, philosophical dilemma, which is, how do you make something as complicated as a human being with so little apparent information?
Yeah, Aravind, I wonder if you could follow up on that, in as much as I guess we discovered that we don't have very many more genes than a worm. What should we infer from that?
Well, I think that says that we have looked at the biological world in a very different and biased way. It says nothing about our genome. It says something about what we believe. An interesting thing is, at a meeting in Cold Spring Harbor, these were annual meetings, and on the Genome Project the year before the genome was fully assembled, there was there was a competition, if you will. There was a poll to see who could estimate the correct number of human genes. And just as Shirley mentioned, the estimates varied all over the place, but most of them were at the high end. I think the fact that we have 20,000 odd genes says that we need to figure out exactly how a human being can be made and is made, not can be made, is made from 20,000 genes. What is it about the rest of the genome that makes those 20,000 genes do all of the varied, biology and physiology that we study?
That's just some of what we covered this week on The Agenda. For more, including the full conversations, you can visit our website, tvo.org, our YouTube channel at youtube.com/theagenda, or our Twitter feed, twitter.com/theagenda. And that's it for this Friday, March 5th, 2021. Next week, we'll hear from nurses in this province on their work during the pandemic, learn how Ontario's court system has adapted during lockdowns, and speak to Nobel Prize-winning author Kazuo Ishiguro about why hope is at the center of his new novel. I'm Nam Kiwanuka. Thank you for watching TVO and for joining us online at tvo.org. Have a great weekend, and Steve will see you on Monday.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. Ontario Hubs are made possible by the Barry and Laurie Green Family Charitable Trust and Goldie Feldman. And by viewers like you. Thank you.